Hello and welcome back. I am Abha Anandita and this is an exclusive episode of IOdishalinks. Today we have with us Dr. Bhagyashree Singh, who is a doctor based in the UK. She has been specializing and researching on the new strain of the coronavirus that has caused a lot of fear and panic. We'll ask her more about what are the plausible dangers and how is this new strain more dangerous and what should people do to save themselves from it. We also have with us Dr. Sahadev Swain, senior doctor and general practitioner, also based in the UK. One interesting fact about him is that he has been injected with the first dose of the Pfizer vaccine. Since it's its practical experience, he'll tell us more about the vaccine and the vaccination process and how the vaccine is efficient on the new strain of the coronavirus. Good evening, ma'am.
Good evening.
Good evening, sir.
Good evening, Ava.
Would you please introduce yourself?
Sure. First of all, thank you so much, Abha. It is always good to see your charming face, and thanks for the invitation here. So my name is Bhagyashree Singh. I'm originally from Bhubaneswar, Odisha, in India. So I work in National Health Services of Britain, that is called NHS UK. I work in South East and Central London in a primary care practice. So I work as a musculoskeletal advanced practitioner in London.
Yeah, as you know, United Kingdom was the first country to start the vaccination program in the middle of this year, and we were all full of interest, enthusiasm, and hopefulness with the advent of this vaccine. And when the lady called Maggie was given this vaccine, I think the whole world was so happy and was clapping with her, and she herself was very happy. And if you go back to the video and see, she said, I felt fine. If I can do it, you can do it. So yeah, I could say the same experience today. Yes, the vaccination was good. I was given the vaccination. The priority for the people who are above age of 80 years, but along with the healthcare workers who have also been prioritized. On that basis, I was given this injection, and luckily, as it usual, I had no side effect with it.
Right, sir.
So I'm very pleased to say that.
So, sir, there can be side effects to the vaccine.
Yes, the side effects can be of various types. There could be local reaction. If you remember when you took your injection ever, if you have, some people are lucky not to have, and then you do get pain at the site of injection, and then sometimes there's a bit of redness stays for some time. So this injection is not different, so it could stay that way. The other reaction for the vaccination of particularly the virus vaccinations, that is systemic reactions, which is like you feel like flu-like symptoms, like a little bit of sore throat, a mild fever, body ache. So these are kind of common side effects, but uncommonly or rarely you could have allergic type of reaction, which is acute allergy, what we call as anaphylaxis. And those can be very serious. You suddenly become unwell with it, feel tightness in the chest, etc. So they are fortunately rare, but they are called anaphylaxis. For example, on the first day of this vaccination, COVID vaccination, in the UK, 2 people who are known to have severe allergy developed anaphylactic reaction. So the regulatory authority quickly changed the guidelines that it should be contraindicated for people who have got severe allergic reactions in the past.
Right. So, and how many doses are there, or how many doses does one need to have?
One need to have 2 doses of vaccination at an interval of about 3 weeks. So although I had my first dose, I'm waiting for my second dose in early January. So with that, say with only one dose, the efficiency or effectiveness of the protection is somewhere around 70%, whereas with two doses, the efficiency is more than 90% or sometimes like 95%. So we recommend that if someone is taking the vaccination, should take both the doses or two doses at the interval of 3 weeks.
Thank you, sir. Ma'am, we'll come to you. Ma'am, there's a lot of panic and there's a lot of frequently asked questions about this new mutant of coronavirus, this new strain that has come in apparently from the UK, and the transmission is known to be the transmission rate is known to be higher than that of the previous strains. So, what exactly is this new mutant, and how dangerous is it?
So this mutant, I mean, as you know, virus, it's an innate property of virus to mutate. And this is not the first time that the virus has done this. In the past, also, virus had a lot of mutant form. And so, I'll give you the best example, considering, you might have heard measles virus or polio virus. We always take that injection. And we need not take that again because so there's a lot of complicacy of virus structure. There's something called antigenic shift, antigenic drift. So virus changes its form. That's called mutation. But when it changes, every year, then we need to vaccinate ourselves every year, like H1N1 influenza, virus. And this property of the COVID virus, the new variant that has happened, that's called antigenic shift. And yes, you're right. It is believed to be originated from Southeast London, where I said I actually work and live. So it is initially it was identified in on September 28th this year. But the more cases were identified in mid-November and beginning of December. So there was a steep rise of the cases in December, and that's when it was investigated more. And as you said, yes, the transmissibility is really high. It's 70% more than the original, CoV-2. And so what that suggests is, it can prove as a super spreader, and Southeast London was a crowded place here. And that's why it transmitted so quick. And it is believed that at present, in the UK, among all the infected patients with COVID, 60% of the infected patients are supposedly from the new variant. So the virulence, which means how bad or how dangerous is it? Nothing has proved. There's no evidence now that this is more virulent compared to the older one. I think in terms of the virulence, it's pretty much the same as the old one. But yes, it is more infectious, more contagious, and more rapidly, spreading virus. Now, one more thing I wanted to mention here, since we are talking about more variant of virus, and there's a new strain from South Africa, and which we're not discussing a lot about the South African variant. That is, I was just checking the news yesterday, and it's even more virulent and it's even more transmissible than the Britain variant.
Right, ma'am. Vaccines, there have been a lot of vaccines, and finally, the people seem to have a ray of hope that coronavirus will be gone and people will be able to come back to their normal lives. Does this new strain put any effect on the efficiency of the vaccines?
Uh, no, as far as we have the best scientific evidence so far, all the vaccines that are in pipeline will be effective till the variations that have happened so far. So we are still hopeful, but in the meantime, particularly I know here in the UK, the scientists are not resting just because the vaccine has been discovered. They are continuously monitoring it, and they expect these changes. For example, like Bhagyasri was trying to say, every year we get a new vaccination for the new strain of flu virus here in the UK, and people are vaccinated every year. So in the same way, our scientists will be studying it quite regularly, and I'm sure pretty quickly they can get on with the new variant, how to control with the new variant. But at the moment, the world body of scientists are saying, are reassuring all of us that they will be effective. So nothing to fear from that point of view at the moment.
Right, right. Ma'am, what would you suggest for for people? I think this the way to avoid the virus is almost as similar to but how more vigilant should one be to take care of themselves from this new strain?
Yeah, it's very important because see, this is a long battle. Now it's been more than a year, I suppose, that we are struggling. So people have come to a stage where they are, lockdown fatigue. They have been following everything, and I would say it is a long battle, but we are getting there. We have not. I mean, we are halfway through probably. So I suggest everybody don't, lose that spirit. We are close to vaccination, especially in terms of India. I heard that vaccination is going to be started in January. So um, let's stick to the old. One thing which is persistent in this period from last 1 year. Even the symptoms are changing, vaccination, different theories, but one persistent thing is the prevention and the precaution. Same thing, wear mask, have social distancing, wear gloves, and take vitamin C, vitamin D. So these are the things that hasn't changed from last 1 year. And in between, we have government regulations are slightly getting, relaxed. As even in the UK, we had tier 2 when this spread. So tier 2 is a softer version of lockdown, as in we have the strictest now, tier 4. So, what I'm trying to say here is, no matter how much you're, frustrated or you're fatigued, but do maintain the strictest kind of, lockdown rules. Like you still avoid going to gathering unless it's very essential. Do avoid going out, especially in a crowded area. Marriages function, it can happen again and again in future, but this position is very critical and sensitive. So just be very careful at this period.
Right. Um, Sir, what would you like, or what do you think about how far this strain is going to put its effect, or spread its claws in India, or how dangerous is it for India?
Um, well, we know if you go back, if you look back year behind when it first started, how we evolved. First, we thought, no, it's not a human disease, and then he said it's only epidemic. Then it suddenly became pandemic, and then it suddenly became kind of a world emergency. So in the same way, we have to take the virus seriously, okay? Because that, like Bhagyasri said, is the innate nature to
Mutate.
mutate. In simple terms, just like we have struggled the war of survival, how we have changed. So they changed to save their lives as well, as simple as that. So they can change, but I think the good news is, like Vagyasri said, is it originated from this part of the world. Now, whether you will be had or glad or sad, but the border of this island is closed. Almost nobody can go anywhere. When people are coming back, they are being quarantined. And I have got soft sources of information. Even those from the UK have reached India are not having a good time. They are
Right.
they are having very strict surveillance. And my brother-in-law was saying somebody in Delhi, in Dwarka, has reached, and there's police in front of this person who has returned from the UK. So you can call them as a VIP, but in the strictest term. So I think that's probably true. So we have to isolate these people to stop the spread of the disease further, because it's very transmissible now. So we have to take that precaution. I'm not sure if I answered your question.
Yes, sir. Right, sir. You were almost there. But then now that we talked about vaccination and we talked about the new strain that everybody is panicking about, what was this? This is a question for the both of you. What were your lives? How did your lives change after COVID-19? Because even when this was a time when people got to spend time with the families, people got closer to the families, people got more time with the families. But for you, it was completely the opposite. You had to keep yourselves isolated. You had to take extra care to go before going and meeting your families. How different and how difficult was it?
Do you want
Ma'am,
to
we'll
go
start.
first? Do you want to go first, Vagasri? Because mine is
Sure.
a long one answer.
Yeah, I think it is a difficult period overall. I'll just add a few more things with the quarantine, what Dr. Swine mentioned. I think in India, obviously, it's amazing how the government is managing with all the rules and regulations. My just only one more suggestion is which the UK government has currently implemented. So what they've done is because of the South African variant, which is believed to be quite lethal, so whoever has traveled from South Africa, they have not only imposed a self isolation for that person, but for the whole family as well for 10 days. So that way, it's very effective to protect as a whole. So not only the person, the whole family, where the person is going 10 days of isolation. And coming back to your question, yes, it's complete. It's a life. I would say this is a lifetime experience. I would remember. I'll probably pass on this to my offspring, because this is usually we work in our own discipline. I work in MSK, Dr. Swine is a GP. So, but this is one problem when it arises. Everyone's focus, no matter what field you work in, you come to that same kind of field and deal with them. And I would say gratitude. I think we kind of took life for granted. Sometimes we just think work, but at this point of time, you realize how important is it in a normal situation. So work wise, yes, lot of pressure, every time you think, okay, is this a day that I'm going to get infected? But I think overall, I would take this as a positive experience, thinking that we are more grateful now than before of our life, of our work, I suppose.
Right.
I would say that it has changed my life upside down. Okay, it is a loss reaction to me. What I mean, the first loss is loss of freedom, the freedom to move. Yeah, as we speak, in the middle of Christmas and New Year, I had taken time off. You know how difficult it is for doctors to take time off. I planned it 6 months ahead to go to Australia to meet my only son. And now we're sitting at home and we are almost confined. When she said that it is level 4, you can only go out for exercise or for buying essential commodities. That's all. How our freedoms are limited that way. And I will classify myself as a social organism. I do enjoy the workplace. I'm working from home from six months. It's very isolating. It's not fun. It's not same as meeting people and greeting people face to face. And then the loss of life and living around me. It's like every day I am hearing somebody I know, and I know a lot of people because I've traveled around in India and the UK, and one person or other, particularly young doctors, dying. It saddens me immensely. And people have lost jobs. I know people who haven't got food to put on the table worldwide. Although as a doctor, my job is safe, and no such problem for me. I'm grateful to God, but this puts me immense unhappiness, to say the least. So that's kind of how my life has changed. Yes, it's good to put positivity to it. It's good to be grateful, to look forward with the hope that vaccine is there. Hopefully, in short time, we'll go back to near normal. But life is not going to be what it used to be before COVID. Never the same. And yes, we will learn from this, and hopefully the human race will be better, will be more respectful to our environment, will be more respectful to each other. That's all I can say in that positive message. I still hope there. None of the pandemics lasted forever. Not this one will not either.
I think I would just like to add one more with what Dr. Swain said about the agony and the mental health of all the healthcare professionals. The other thing is when, like people like us, when we are away from our home, like we have got family back home in Odisha, India, now, that is another kind of issue. When they worry about you, when you worry about your family, that's another added stress. And another thing, we realize the importance of media key workers, which probably previously it wasn't valued. Like you think the people like yourself who are still at work, cleaners in the road. People who were kind of not valued before. So that sort of thing has come into picture as well.
Right. Ma'am and sir, we'll wrap it up with the last question. Uh, like swine flu never saw a vaccine, but there have been several articles that say or that there have been factual conversations that come to the conclusion that vaccines give you side effects and they harm your body somehow, even if they save you from one disease, but then they harm your other parts or other organs or whatever you can call it in the doctoral term. What do you have to say about it?
I think Bhagyasri has got a beautiful terminology. She's called infodemics. I think I'll let her go about that first.
I think, yeah, regarding the practical experience of vaccination, Dr. Swai will explain. But I would say, yes, the infodemic means, it's a term used by WHO. What that says is, at the moment we're fighting two things. Pandemic is what the problem is. Infodemic is a lot of miscommunication or misinformation has been spreading. One person telling something and that gets, exaggerated. So, yes, all the vaccines, all the medication will have a side effect. Even you take paracetamol. If you, when we were in medical school, when we read in books, it says so many side effects. But it depends on the practicality and what we are trying to achieve here. So, as Dr. Swai has very well explained at the beginning, or some of the side effects, but bear in mind it was tailored or specific to a few kind of individuals. So other side effects, I'll let Dr. Soy explain if there is any other thing that he wants to highlight on this.
Yeah, I will start with Ava. Have you ever taken paracetamol?
I have, sir.
Yes. Have you ever, if you haven't, I'll tell you to, have you ever looked up what are the side effects are? If you haven't, I'll tell you go back. They also have side effects, including damaging your liver and kidney. But I don't want to give this information to people and frighten you. So life is all about benefit and risk. Yeah,
Right.
the in balance, we take a path, or we are walking on the road, we go left or right, we take a decision and go that way. In the same way, life is all about benefit and risk. So
Right.
there is immense benefit here than the risk, and particularly when you know the side effects, you can deal with them. They're not serious side effects, but COVID is serious. We know people around us are dying, so that's one thing to keep in mind. I think we have to learn from history. I don't know, you're probably too young to remember. I know people have died from smallpox. I know my aunt, my dad's sister is still there. She's blind in one eye from smallpox. But pat yourself in the back that you will never see smallpox. Yeah,
Right.
and
Yes.
say polio is another thing. Okay, remember how many people you will see they are invalidated with it. Yeah, but luckily with concerted effort, polio is also going to be past history. We're not going to miss them. So
Yeah,
vaccines are very important to keep in mind. And what we are here, I think the side effects that we are talking about are minimal and the benefits are much more.
It was absolutely delightful to talk to the both of you. I'm sure
okay.
our audience will have an insight and the FAQs, frequently asked questions, are answered.
Thank you.
Thank you
It
for
was
having
it.
us, and we wish you a very happy new year to all your viewers. And let's be hopeful. Hope is the only thing that has kept the mankind going, and we live in hope.
Absolutely. Yeah,
Thank
I
you.
would
Happy New Year.
also, just to end with, I would also request if anybody has any question, you can write below and we would happy to be answered.
Yeah. Yes. Thank you so much, ma'am. That would actually help. Thank you so
Okay.
much, sir.
So
Thank
much, sir.
you.
Thank you.
It was indeed a very insightful conversation, and I'm sure a lot of the lingering questions have been answered. But in case you have any more questions, please write down in the comments below and they will be happy to help. Thank you.